kahit sa ER no ng PGH. So let's welcome Dr. Belle. Hello, Ma'am Belle. Ma'am Belle,
Hi,
hello.
Mer.
Hello. So yan, hello
Good
ma'am, and you can
evening.
also say your hello to our participants.
Good evening, everyone. And thank you, Pisca, for this invitation. And thank you as well to everyone who's attended and who chose to spend their evenings tonight with us. Thanks for the kind introduction, Mer.
Hello, yan, nice seeing you again, ma'am. Okay, so ayan, I'll introduce naman our next speaker. No? So next we have Dr. Raymond John Naguit. Okay, so Dr. RJ Naguit is a Filipino activist, nurse, medical doctor, and mental health advocate. He graduated Bachelor of Science in Nursing and Doctor of Medicine from the University of Santo Tomas, Manila, and is currently pursuing a Master in Community Development degree from the University of the Philippines, Diliman. So currently, he serves as the founder and board president of Youth for Mental Health Coalition and the national chairperson of Akbayan Youth, the youth wing of Akbayan Citizens Action Party, a socialist, feminist, and ecological political party in the Philippines. So he works with various social movements on campaigns related to democracy and human rights, labor, women and LGBT, and youth issues. So hello, Dr. RJ.
Hello po, magandang gabi po sa lahat, and thank you Peace Cup for the invitation, and I'm really excited sa magiging discussion natin this evening.
Okay, so thank you, Doc RJ. And our last speaker no, is the representative of the teens. So she is Maria Mikaela Cabrera. So Mika is 18 years old, a student from FEU Alabang. So hello, Mika.
Hello po, good evening po. I'm Maria Mikaela Cabrera po, and I'm a grade 12 student po from FE Alabang. I want to say thank you po for this opportunity to speak for the teens and to be a representative for Youth for Mental Health po.
Okay, all right. So now that we know our speakers, so let's go to the meat of the matter. So to know more about the topic, here's Dr. Belle to discuss with us languishing and resilience. So Dr. Belle, take it away.
Thank you, Mer. I'll be sharing my slides. All right. So tonight we're going to be talking about something very interesting. It's actually two things that we're going to be talking about tonight, languishing and resilience. So back in April, specifically April 19, I woke up and I was thankful that I opened a Viber link that led me to an article from New York Times, and it's about languishing. The title was, there's a name for the blah that you're feeling. It's called languishing. The authors actually actually used the term that was originally coined by a sociologist, Corey Keyes, to describe what we've been feeling over the course of the pandemic. And they described languishing as a state of not being depressed, but also not thriving. So they said that it's not that you're sick, it's not that you're having a disorder, it's just that you're also not completely well. So a lot of the descriptions used to describe languishing included feeling a sense of stagnation and emptiness, which I think resonates with a lot of our experiences. Because the more I explain this, I discuss this with my friends, my colleagues, and even my patients, the more that they kind of relate to those descriptions. And a lot of them agree also that it's like you're modeling through your days. It's like the days are blending together and you're looking through a foggy windshield. It's like you're parang you're on a roller coaster. But you don't even see where you're going. It's like an endless drive, but you don't know where you're headed. So languishing in that article is said to have the tendency or the likelihood to dull your motivation. It can disrupt your ability to focus, and it triples the odds that you are gonna cut back on work. So it can lead to some days off work, or for our youth, some days off school. Hold on. All right. So if we trace back, languishing is actually not a new term. It recently got popular because of the article, but it's actually been around since around 2002. So almost 20 years from 20 years ago. And as I mentioned, it was coined by the sociologist Corey Keyes. So in the original article, the question that was also asked was, is the absence of mental illness reflective of genuine mental health? So it's like asking, if you're not ill, does that mean that you're healthy, that you're well? The short answer to that is no. And it's very much relevant to WHO's description or definition of health. Good health is a state of complete physical, social, and mental well-being. And importantly, it's not just the absence of disease. So if this is you flourishing, being mentally really well, and this is you being depressed, somewhere in the middle, you're not completely well, and you can be languishing. So that's why in the New York Times article, they also describe languishing to be the middle child of depression on one end and flourishing on the other end. It feels like you're stuck in the middle. Yeah.
Okay. So, yun pala yun, Dr. Bell, no? Parang hindi ka depressed, pero parang hindi ka rin naman okay. So, parang you're not mentally healthy also. So,
Right.
anong aspects ba ng buhay natin yung nag-lead to languishing?
I'm sure everyone has had their share of struggles during this time of the pandemic. And I try to put into categories lang what we know to have been the struggles or the disruptions that we've experienced in our lives over the past year of the pandemic. We know that somehow we were able to find ways to deal with it after the acute state of anguish. But the fact that the pandemic has dragged on and we're still dealing with these things are actually what led to languishing. So if you look at all of these 5 categories, I think I can summarize this to losses. We've lost a lot during the course of the pandemic. And these are the different ways that we have experienced the losses. First, we've lost loved ones because of the pandemic. And what we have to remember when it comes to COVID losses is that it's a unique kind of loss because it's a kind of loss that we didn't even know what we're up against, what was the cause of the death, really. We didn't know a lot about the virus. And at the same time, it was a kind of loss that was unexpected for many of us, sudden also for many. And it's the kind of loss that prohibited us from being able to be there with our loved ones during the time that they're getting treatment, and even during the time that they had to be cremated. We even the memorializing our loved ones, even the funerals, we lost that. We lost the rituals of grieving. On the other hand, we also lost experiences, and I'm sure a lot of our youth have been impacted by this. We've heard people missing out on graduation. We've heard of people missing out on the first day of college, which is so sad. We've had people missing out on birthday celebrations, travel plans, summer plans, Christmas plans. And very important too is the disruption in the connectedness. Youth is a time that you're supposed to be enjoying time with peers and even getting into romantic relationships and getting to know new people in different stages of life. Be it, kunwari, you've just graduated, meeting new people in their workplace or in terms of organizations. So the usual face-to-face has been gone, has been taken away because we have to keep safe. But we lost that connectedness. Some would say, okay, that means more time with the family. And yes, for many, it's a good time. It's just that sometimes that constant presence at home leads to some tension and can also disrupt the connectedness with our family. So that's another loss for our youth and for the members of the family. We've lost routines. Life as we knew it suddenly changed, and the routines that came with it totally changed, di ba, Mer? So parang ang dami, bigla, in a snap, parang you wake up one day and everything's just gone. What I know about how I'm supposed to go about my days has changed. And a lot of it also has to do with losing control. We don't know what's happening. We don't know how long this is going to drag on. We don't know how to really keep us safe, okay? Especially during the early parts, okay? We lost the sense of security in terms of our health, in terms of economics. A lot of people lost their jobs, okay? And it impacts the family members. So these are a lot of things that have been going on and that have led to feelings of anguish. And then eventually now we're looking at feelings of languishing. So, okay, of course, these are not good experiences, but I think the silver lining here is that that article put a label to our experiences and it felt validating. Diba? That's
Yes,
why I was
correct.
so grateful when I read that article because I felt validated. And then the more I was talking about it with people, it turned out that it's very common. And I think the fact that it became viral is because a lot of people can relate to the languishing term. So it helps to be able to put a label to something because what we do know is that one of the best ways to actually manage emotion is to be able to label it first. So we have a label and it's languishing. And the good thing about it is we know what we're up against. What we're up against comes with two aspects. On one hand, what we do know about languishing, based also on the study of, based on the article by Corikis, is that people who are languishing may be at risk for developing depressive or anxiety disorders or other mental health disorders later on in life. In fact, in that 2002 article, she compared the risk of depression of somebody who's languishing and of somebody who is flourishing. So flourishing means you're at your best health, you're at your best mental health. And they found out that those who are languishing have up to 6 times higher risk of developing depression and anxiety disorders than those who are flourishing.
Ang taas
And
nun,
when you
ma'am. No?
mataas talaga. So at least it informs us, we're aware. And if you compare it with people who are in the moderate level of mental health, not at their best, but they're at least there's some level of thriving. Those who are languishing are still at 2 times higher risk of developing the disorders. So we know what we're up against. We know the risks. We know that it can be a risk factor. On the other hand, the good thing I think that also comes with the parang the other flip side of the coin. Kasi we know and we acknowledge that there's those risks. But a new article recently came out just a week or so, a little over a week ago. And it's also inspiring and reassuring. And the title of the article was "The Pandemic Did Not Affect Mental Health the Way That You," sorry, I cannot read, "the way that you think." Okay, and it was authored by psychologists. They did a study of available researches and looked into how everyone or how the people have been recovering or dealing with the pandemic. And what they found out was that the world's psychological immune system was actually more robust than we expected, despite what we know about anguishing and languishing. There is still some findings that despite the fact that there were initial increases in psychological distress during the early months of the pandemic, later on, months after, most of the facets of psychological distress like depression, anxiety, or stress level, a lot of studies actually point to them going back to the pre-pandemic level. The distress level actually went down. And among these studies, they saw that there were notable signs of resilience. So makes us hopeful. But the good thing about this article is that they did not disregard the fact that there are people who are really suffering. We acknowledge that there are people suffering, but we also don't want to overlook the fact that there can be resilience. Okay.
Yes, so at least
And
parang two sides of the coin nga,
yes,
ma'am. No?
yes. Kasi it's very common to just focus on the pathologies, diba? And
Yes.
to not really look at our strengths. So I think this is a good article to remind us. Okay. So it actually is very similar to what the other psychologists George Bonanno actually mentioned about resilience being the most common trajectory after loss. When we talk about losses and we talk about trauma, the first thing that comes to mind is traumatized. Okay, and rightfully we give due attention and support to those experiencing post-traumatic stress disorder. But what we neglect sometimes to see is that there's such a thing as post-traumatic growth, that people can actually bounce back from all of these traumatic experiences. And the idea that we can bounce back actually tells us that human beings, us humans, we're not just passive victims of change. We're also active stewards of our own well-being. Despite the situations and adversities that we experience, we can take control, we can take charge, and we can go through them and be able to grow eventually.
Okay.
Yes.
So, Dr. Rabel, what exactly is resilience?
So resilience actually came from a Latin term that has a literal translation of bouncing back. So bounce back basically from adverse experiences, from traumatic experiences, from stress in general. And so it's defined as the process of adapting to difficult situations. And it can also involve profound personal growth, like I said. We can grow from certain experiences despite the difficulty, despite the negative experiences that you would have along the way. Resilience, as we know, it will not go make your problems go away, but it can help you be able to carry on, be able to see past them, be able to still enjoy a life despite of what's happening, and ultimately be able to handle the stress without getting overcome by it. Okay. The thing with resilience is it's not necessarily a personality trait that only few of us have. Very important to know about resilience is that it's a set of skills and thinking processes that any one of us can learn and develop. So all of us have the capacity for resilience. And there are many articles about resilience, and one that I like is the one is how Susan Kobasa, she's another psychologist, because she defined the different elements of resilience. So to me, what she said gave me a picture of what's a resilient person like. What is it like to be resilient? And she says it's the three C's: challenge, commitment, and control. So just to briefly go over them one by one. When we say challenge, resilient people are those who are able to see that difficulties or adverse situations are actually challenges to be overcome. They don't see difficulties as paralyzing events. Instead of thinking of their mistakes, of their limitations as a burden or something that they cannot get past, they see it as opportunities for learning. They see it as opportunities to grow and to develop new skills for themselves. Okay, so that's the kind of mindset that they have. Another thing about resilience is that a resilient person is committed to living your life despite of the adversities, committed to your values and your dreams, because those values and dreams are what can motivate you to carry on. Those are the things that can make you get out of your bed and take one step at a time, take one day at a time. And another thing is that they have a sense of personal control. I think the sense of control is very important because there's a lot of things that we don't have control over in this world.
Yes.
Diba? And
Yes.
a lot of times,
Agree.
diba? But a lot of times we're not all aware that when these are the things that we don't have control over. And if we're too focused on the things that we cannot control, then it makes us struggle more and be miserable. And it keeps us from being able to bounce back and learn from the experiences. Those with resilience are able to acknowledge when there's not a sense of control in certain areas of their life, and they're able to refocus their energy and their time on the things that they have control over. So that when you're able to focus your time and effort on these things that have more impact, it's more empowering to you. And it builds your confidence, di ba? Because you can take charge.
Yes, correct. Oo. So, yun, ang ganda nun, no? Yung, ito yung parang isa sa mga takeaways natin from this talk, yung 3 C's, no, of resiliency: challenge, commitment, and control. No? So, Dr. Belle, paano naman nag-manifest yung pagiging resilient natin nitong especially during the pandemic?
I'm sure in a lot of ways. In the same way that we have those things that have affected us negatively and have caused the anguishing and languishing, I'd like to use the same slides, all right, to show you how we actually were able to overcome them and become resilient. We've lost loved ones, but we've found ways to grieve them. I've heard of people doing online eulogies, online wake, telefuneral. So those are ways that we can still memorialize, diba, the loved one and do our rituals. The hashtag new skill unlocked. A lot of us turned into plantitas, plantitos.
Yes.
We've learned new
Bakers.
languages. Right, diba? Natuto tayo mag-bake. We learned new languages. I tried learning Korean.
Wow.
Yeah. And sometimes we actually realize that, oh, I can do this pala. I didn't know that this is one thing that I can do. I didn't know this is one skill that I can learn. Okay.
Yes,
So
oo.
we
We
were
didn't
able.
have the time lang before, no?
Exactly. But now, given that unfortunate circumstance, we were able to be resilient and even grow from that experience.
Yes.
Diba? So the other one is we lost face-to-face connection. So push to the wall, we had to shift and migrate to digital life. It's not been easy for sure, especially for online schooling for our youth. But what we do know is that somehow they've carried on. Somehow it still worked. It's not the best, pero kaya naman. We've been creative in terms of connecting with friends. You have Zoom parties, di ba? Watch
Yes.
parties. You have parang yung mga, it's interesting. I have one patient na um, they use a social platform, online platform, to study together, do group
Mm,
study. And the way
yes.
that they do it is they do Pomodoro. Pomodoro is an app that you can use to set time for studying and set time for resting. So the good thing is they study together when it's study time. And when the alarm goes off that it's break time, that's the time that they chat together.
Yes.
So,
I have patients din, ma'am, no,
di
na
ba? Di ba? It's so
nag-group
nice.
study sila online. So,
Good,
yan,
good.
creative ways talaga.
Yeah, and I really admire them for being able to come up with those strategies. And they really get to help each other and still feel connected despite the distance, di ba?
Yes, correct.
New normal is one of the most popular terms in the past year because despite the fact that we lost our routines, we were able to bounce back and establish a new normal. A new normal in terms of how we school, how we study, how our schedule goes. And part of the new normal is not having to deal with traffic. So that's still
Correct. Yun
diba?
talaga, oo.
New normal. New normal is being more careful so that we can be more in control. We can still take charge of our health, not fully, but to a certain degree, diba? And some people have made changes in their career when they lost their jobs, diba? And some people actually realize na, oh, this is better off. Oh, it actually allowed me to look into other greener pastures for myself. So
Yes.
in a way, we've become resilient. And I think the other thing that I like about our culture as Filipinos is that our resilience came with a way of humor. Di ba? Parang we went through this the whole year and there's a lot of humor. You see a lot of memes. And
Yes.
this is
Oh,
positive,
ang
di ba?
dami talaga. Yes.
It's really fun. It's very nakakagaan ng emotions. And it makes us proud because we see the resilience of the Filipinos. Diba? So there is actually a slide lang, that I want to go back to when it
Yes,
comes
please. Yes.
to the COVID situation in the Philippines and the role of resilience. And this is just to really demonstrate how there was really an initial period of anguish. And then what were the factors that were related to resilience among Filipinos. And the first article was done during the first months of the pandemic. And yes, we saw that there were one sixth to one-fourth of respondents. This is over 2,000 respondents that said that they were impacted in terms of having symptoms of anxiety and depression during the first month of the pandemic. Okay. Again, it echoes the other experiences of anguishing. And later on, the next two articles were done 5 to 6 months into the pandemic. And they were able to see again signs of resilience, such that they saw that those who, there were people who actually had less stress and less fear related to COVID, primarily because they have higher resilience level. So they measured the resilience level of these people and their stress level and their fear level. And they saw an inverse correlation wherein the higher your resilience, the lower your COVID stress and fear. Okay, this is actually, this study was done among graduate students around the age of 20 to 40 plus. So still covers the youth age, and many of us who are also part of the PSCAP and other professions. So the other article naman is about college students. Its mean age is about 20 years old, and they saw that those who are resilient, with higher levels of resilience, and those who are able to perceive higher support system actually experience lower levels of lockdown fatigue. So just briefly, lockdown fatigue is like languishing, feeling exhausted from all the disruptions in the course of the pandemic and the lockdown. Okay, so we see that resilience plays a role in terms of our response to the pandemic and to the lockdown.
Yeah, so yun nga, no, very important talaga, no, yung resilience, especially now. And as you mentioned kanina, Dr. Rabel, no, anyone can learn and develop resilience. So, but the more important question is, paano, di ba?
That's true. That's true. Yes, everyone can develop resilience, and I'll just try to present some strategies by which we can build our resilience. So, first is building connections. Us as social beings, it's important that we build connections because the social network is a source of social support. Okay. And when we have a social support system, especially of people who are able to be supportive to us and respond well to our emotional needs, even physical needs, then we're able to feel a sense of security and even a sense of belonging. And like what we see in our youth, they share notes, they exchange ideas of how do I make myself feel better? What can I do now so that I can fill up my days? So it helps you find out about coping strategies and coping skills. So we need to be connected, especially during this time of loss. Loss and trauma can be isolating, and it's very important that we reach out for support, especially from the support system that we have available. And then we try to find purpose in each of our days. The first thing to do is to be able to be in touch with yourself, find out how you feel, and ask yourself, what do I need? What will give my life purpose for today? And how do I work towards that goal? How do I work towards that purpose? Means that it can be highfalutin, it can be a lot of big dreams. So what we can do is just really break them down. If I can't reach that day, what can I do so that I'm one day closer to my goal? Diba? So I hear of people parang realize that I've gained so much weight during the pandemic, but I know 20 kilos is not easy to lose, even if it was so easy to gain it. So,
Yes.
so I'll just start with maybe cutting down on juice, cutting down on soft drinks. And it gives you purpose each day. It gives meaning because you know that you're working towards something. Okay.
Yes. So yon, ano, no, parang ang ganda na na-note natin na yung building connections are very important, na we can get it, no, from like our parents, caregivers, from our friends also, especially for the young ones, kasi yung friends talaga yung ano, 'di ba, important in their sa stage and their ng buhay nila, no. And also yon, yung nabanggit nyo, Doktora, yung finding purpose, no, by helping others, and also yung being proactive. So aside from that, what else can you do?
Sorry, just for the finding the purpose, yeah, you mentioned about helping others. The
Yes.
helping behavior is actually a good way to find purpose. When we're able to help another person, it empowers us. It tells us that, oh, I can actually make a change, or I can bring something good in another person's life. And it makes us, there can be hope in the things that are happening around us, even if it's just a small gesture that we do. Diba?
Yes, correct.
So the other thing is fostering wellness. This is something that I always emphasize to my patients. My patients always hear me saying that they have to take care of themselves. I always say, take care of yourself. And I say that because it comes from many different places for me. First, when we take care of ourselves and our wellness, meaning you sleep well, you exercise, you eat well, you take care of your physical body. It's important because sabi nga ng WHO, di ba? It's not complete health if there's a missing component of physical health, di ba? And now that we have to deal with a lot of emotional things, you need to be physically able to carry on emotionally. Okay.
Yes.
The other thing that I advise, the reason why I advise my patients to take care of themselves is because fostering wellness starts with being self-aware of, again, how you're feeling, so that you're attuned to yourself in terms of what do I need at this moment, what will help me be okay at this moment. And knowing that, it again motivates you, it directs you, and it empowers you in terms of doing what is good for you. And when you know that you're taking care of yourself, it makes you see that you have the capacity, you have the capability to make changes in your life. So fostering wellness is important, and we have to make sure that when we try to cope, we find strategies that are healthy for us as well, not strategies that will just make things worse for us. It's okay to be drinking alcohol once in a while socially, but we also have to check how it's affecting our mood, because it can. Some of us would say, I need it for sleep, but you have to check, because actually alcohol can disrupt sleep, can cause sleep interruption. So
Yes.
we have to find ways that are healthy in terms of fostering our wellness. Okay, and then embrace healthy thoughts. This is something that I always really emphasize also. Like I said a while ago, it's always a flip side. There's always two sides to a coin. Even if we know that there things are going bad, we still have to acknowledge how things are going well. And the sense of control and acceptance, change and acceptance is also important. We have to be able to embrace a certain level of acceptance of things that we cannot change, so that we can go about changing and being in better control. So that's how we can embrace healthier thoughts, by keeping a balanced perspective. Okay. So the way that we think affects the way that we feel and the way that we act. And we want to start with healthy thoughts so that we feel better and we do better.
Yes, so yun nga, no, healthy thoughts talaga siya nag-uumpisa. No? So,
Yes.
yan, we've talked about, again, in addition, yung fostering wellness and embracing healthy thoughts. But what if, for example, Doktora, parang you are stuck, no? And parang you're having difficulty in progressing on your path to resilience. Is there any other option?
All right. That actually one of the options too is seeking help. During this time that a lot of us are having difficulty, it's all the more important that we reach out for help when we feel that we're having difficulty. Um, Asking for help from a professional, asking for help from our family, like building connections, is important, because it can help us make more sense. It can help us brainstorm, and it will give us the help that we need during that time that we're not able to be there for ourselves, or we're not able to fully deal with our situation. So ask for help. That's important. And there are a lot of professionals, mental health professionals that are available. We have our psychologists, we have our counselors, we have our psychiatrists.
Okay.
Yep.
So,
I'm sorry.
yes,
So
Doktora, do you have anything else to add?
just in parting, last word lang, this is something that I actually like. It's a statement by William Halsey, and he says that it's very relevant to resilience. It says that there are actually no extraordinary people, only extraordinary challenges that ordinary people rise to meet. So all of us are ordinary. This is COVID and lockdown. The pandemic is an extraordinary challenge that we all can rise to meet.
Wow. So yan, ang ganda naman nung parting words ni Dr. Belle, no? So thank you so much, no,
Thank
Dr.
you,
Belle, for
Mer.
the very enlightening and substantial lecture. So it's good to know that yun nga, no, we have a label on what some of us are feeling, especially now, no, and at the same time, it's very encouraging then to know that we can do something about it. And just like what you've mentioned earlier, no, we're not just passive victims of change, but active stewards of our own well-being. So, yan. So, thank you, Dr. Belle, again for that enlightening lecture. So, yan. Now, no, maybe you are itching na to ask your questions and give comments, no, on the lecture of Dr. Belle. And yon, you can do that as mentioned earlier, no. You can put your questions and your comments on the Zoom chat box and on the comment section in Facebook. Okay? So, sige, let me read first a comment kanina, no, from FB, from Facebook. So, a participant mentioned that I use both the Pomodoro technique and the Eisenhower matrix to manage my time and priorities. So
That's
yan,
nice.
yung isang participant natin is aware of the Pomodoro technique, and yun, I just saw a meme, no, na parang sana hindi yung reverse Pomodoro yung ginagawa, yung mas marami yung break kaysa yung marami yung kaysa dun sa actual na kailangan gawin. So, yun, marami tayong strategies, no, na natututunan from our mga peers, no, kasi yun, parang what works, katulad you mentioned earlier kanina, Doktora, no, parang what works for me maybe can work for you also. So, yun, doon nagkakaroon ng mga sharing of insights. Okay? So, all right. Sige. We have a question here about a tool or a validated tool, no, to assess resilience. So do we have that kind of assessment form, Doctora?
The studies that I cited, what they used was the brief resilience scale. It's a self-report questionnaire. It's a short one. It's 6 items, and it asks about a person's perception of his resilience in different statements. It has reliability studies, but I was not able to come across a validation study. The reliability is good naman for that scale. And I think that's why it's used by the various studies that I cited. So it's the brief resilience scale.
Yeah, okay. And siguro the challenge then for our younger psychiatrists, no, to maybe explore that as a research, 'di ba? Validation of tools. So, yan, para magagamit natin on our local setting. So,
Yeah.
We have a question here from in Zoom, no? Does spirituality play a role in building resilience? So how do we approach talking about these in teens?
All right. First, the question of does it play a role? Yes, it does. Because our spiritual belief and that forms our values, diba? They're part of the things that keep us going. They're part of the things that we try to uphold as we go along and deal with our situations. And if we have that kind of spirituality and faith that makes us withstand those problems, those difficulties that we have, then that's what helps builds our resilience. So yes, spirituality is a big part. And the question of how do we communicate spirituality to our teens, it's a very common struggle between generations when it
Yes.
comes to religion. And what we want to emphasize is focus on spirituality, on faith, in the belief that there's something of a higher being that can help you, even if there's not a lot of evidence for it. I try to really encourage not focusing on religion, but on spirituality. Religion is the social. I think it's a social aspect. It's the things that we do as part of our spirituality. But spirituality refers more to the relationship you have with your God, with the higher being that you believe in, that you have faith in. And I think for anyone, it's more important that you have that kind of relationship, that you know that you can look to someone, pray to someone, and know that there's something out there, somebody out there who's praying for you. And usually teens and youth are not resistant when it comes to topics of spirituality. Sometimes it's more challenging if we insist on a religious practice or a religious belief. Um, and usually the idea is we allow them to explore, because what works for them is what's important. What will keep them going is what's important. As long as they're able to build a spirituality, then that is what's important. Sometimes it's a struggle lang, for parents. Yeah.
Yes.
Mhm.
Okay, so I'll read some comments muna before some questions, no? So from Dr. Batar, no? So thanks, Belle, for that simple but very, very substantive lecture. And also from Julieta
Thank you,
Katunga,
Dr.
no?
Batar.
Kudos to Dr. Belle for a comprehensive and informative lecture.
Thank
So
you.
okay, we have another question, Doctora, no, from also from the Zoom chat box. So how do you help a teener healing from anxiety and depression develop resilience when he or she herself is still managing her or his emotions and trying to deal with life?
All right. So what we do know about depression and anxiety is that it's a biopsychosocial spiritual condition. There are different factors that contribute to and can be used to help those experiencing depression and anxiety. Biologically, we know that they're brain-based problems, and that's why we always advocate for professional consultation when it comes to the disorder, so that the biological aspect is addressed. The part of management is not only the management doesn't only stop at medication, because psychologically it's also important to help them build strategies so that they are able to deal with their emotions, their symptoms, and be resilient. So actually, if you look at the framework of our therapies, the psychotherapy that we do, it's building resilience. It's
Mm-hmm.
helping them have a mindset or a perspective that's healthy. It's helping them commit to certain things that they look forward to, commit to their aspirations. It's helping them see things in a balanced perspective again, di ba? So we are, even those who are depressed, even those who are anxious, have the capacity to build resilience. And sometimes them knowing more about their emotions, knowing more about their symptoms, gives them all the more capacity to know what is good for them and what will be helpful to them. So they're not necessarily at a disadvantage. Although what we do know is they need our help, and that's what we give them. We help them in terms of being able to um, get through the difficult stage and equip them with the skills so that eventually they'll be able to go off on their own and deal with the struggles eventually with their capacities. So it's capacity building really
Mm-hmm.
and skills building.
Yeah, okay. So, ayun, no? I will also read a comment and a question. So, someone from Zoom, no? Thanks, the lecturer and Dr. Rebel for the lecture, no? And yun, he now understands, or he or she now understands what he or she feels, no? So, at least yun nga, no, putting label on it, as mentioned earlier. And yon, from ano naman, from FB, no? So we'll um have this as our last question muna, and then we'll proceed. no, so that we can give way to the other speakers. But keep those questions coming. We will entertain them later. No, so I'll just ask Dr. Rabel, no, from this is a question in from Facebook. How has it been, no, for psychiatrists to offer mental health services during the pandemic for teens?
All right. I think I speak in behalf of PSCAP and all the other child and adolescent psychiatrists when we say that especially during the initial part of the pandemic, we were overwhelmed. There was a lot of demand for services for mental health among the youth, primarily because we know that the youth really is a vulnerable population. And a lot of studies have shown that being in the youth group, being a student, is actually a risk factor for developing languishing or all those psychological distress from the pandemic. So we had to really stretch the services that we have. We've been really very proactive in terms of giving out this seminar so that we get to educate the youth, equip them with skills, diba? Because sometimes they don't necessarily have to consult when they feel that they're kaya pa naman, but it helps when we are able to give those information online so that it helps them deal with whatever they're dealing with at the moment. So a lot of efforts have been put in terms of information dissemination and really educating the people during the time of the pandemic.
Yeah, okay. So ayan, before we na proceed, I'll just read a comment from Dr. Banaag, no? So hello, Dr.
Hi,
Banaag. So
sir.
ayan, congratulations, Belle. Proud of you. So by the way,
Thank you.
spirituality is also experienced with a walk in the woods or watching the sunset or sunrise. And since someone had created this, no? So yun,
That's
even those small
nice.
things, di ba? Ano rin, part of spirituality also. So, thank you,
Thank you,
sir, for
sir.
those words. Okay. So, sige. Pause muna tayo kay Dr. Rabel. But she'll still be here, no? In a while. So, but now, we will go to our next speaker, si Mika, no? Okay. So, yan. We will hear her sharing, no, about her experiences during these times, no, and we'd like to thank Mika for allowing us, no, to use this platform in talking about you and your story. So Mika, the floor is now yours.
Good evening po. Good evening to our esteemed speakers and moderator for this learning session. I am Mikaela Cabrera, Mika or MMPO for short. I am an incoming freshman college student and I will discuss my experience with online classes during this pandemic. I hope you are all doing well po. So last year po, January 2020, nag-resume na po kami ng classes after a short break to celebrate Christmas and New Year's po. After nun, yung UCSP teacher po namin or Understanding Culture, Society, and Politics, pinag-usapan po niya yung global issues. Natatandaan ko po na pinag-usapan po niya yung possible World War III, tapos yung novel coronavirus or COVID-19. Pero nung time na po yon, I just brushed it off kasi there were no cases in the Philippines yet. Tapos, fast forward sa March 14, 2020, Saturday po nun, and our midterm exams were done. Yung mga closest friends ko po, nakatambay lang po kami sa loob ng sa classroom, nagti-TikTok lang po kami nun. Doon po nagsimula yung TikTok, ko po. Yung mga teachers po namin nun, nag-grade na po ng exam. So, we had the whole day to ourselves. Tambay lang po. Little did we know po na yun na po yung last time na magkikita kami. Kasi po yung school po namin, a few meters away lang po sa RITM or sa Research Institute for Tropical Medicine, kung saan po dinadala yung first cases ng COVID po nun. After that, nung following week, nag-suspend na po yung school namin. To be honest po, homebody po ako. So, hindi po ako masyadong lumalabas sa bahay. Pero po, gusto ko pa rin pong lumabas from time to time kasama po yung family and friends ko. Ano po, I felt stuck inside my own home po, ganun. Pero I only played my favorite video game since for ease my anxiety from the spreading virus po. Tapos po, kahit po na-suspend na, kailangan po namin ituloy yung performance task namin, pati yung mga quizzes. Since schedule ko po is Tuesday, Thursday, Saturday, may online classes po kami on Monday, Wednesday, Friday. So, hindi po mahirap sa akin na mag-adjust sa virtual learning, pero hindi po ito yung case for most students. So, after po noon, nag-announce na po yung government ng lockdown. The days turned to weeks, and I was starting to miss my friends po. Hindi po namin kaya magkita, kahit po sa bahay, kasi po naka-lockdown. Nagme-message lang po kami or video chat through Discord. Kaya ko lang po ma-think yung mga memories na ginawa namin inside and outside the classroom, like our McDo hangouts after a long tiring day, or playing at the arcade to distress po. We may be chatting through Messenger or video chatting on Discord, but the feeling wasn't enough po. So, medyo na-down po ako ng that. Pero ngayon po, okay na po kami. Nag-uusap-usap pa rin naman po, pero minsan na lang po pag may time. Tapos po, nung grade 11, hindi na po sila yung classmates ko this year. So, medyo mahirap po makipag-socialize sa mga bago ko pong classmates this school year sa virtual learning. Kasi po, I'm an introverted person and I don't interact with them unless they first approach me. Tapos, I also had this feeling of awkwardness to introduce myself through messaging only. Nasanay po kasi na all these years po, tatayo ako sa harap, tapos mag-introduce po ako face-to-face sa mga classmates ko. But now, hindi ko po magawa yun sa messaging only. Ang hirap po mag-bond sa mga classmates through chatting, ganon. Kasi there are no tone, facial expressions, and body gestures that give social cues during interactions. Hindi po namin na-experience yung prom and graduations at yung mga ibang significant events na nilook forward ng mga students kapag face-to-face. And ngayon, wala kasi virtual classes. Pero almost 2 years ago, meron kaming kick-off party. Yung kick-off party is when we start our academic year bonding through music. Marami pong nag-perform. Pero hindi ko na po maalala kung sino sila. Ngayong year po, wala po masyadong mga activities. So, na-feel ko na incomplete yung high school experience. Tapos, itong next part ng sasabihin ko is yung about sa mental health ng mga students. Kasi merong added stress and pressure from online class. Nag-decline din yung mental health nila. Nag-decrease yung social interactions natin sa mga kaibigan natin. Although, meron namang mga interaction through online. Iba pa rin yung feeling na makakasama mo sila physically. Kasi nagtatawanan kayo, tapos nag-bonding kayo, kakain kayo sa labas. Tapos, sleeping patterns were disrupted. Ako, na-feel ko to kasi ngayon, a few months ago, maaga ako natutulog mga 9 or 10, tapos gigising ako ng mga 6 a.m. kasi nag-exercise pa ako noon. Pero ngayon, almost 12 a.m. or 1 a.m. na ako natutulog. Minsan, pag hindi ako makatulog, mga 3 to 5 a.m. na ako natutulog. Pero minsan lang naman yon pag nagkape ako tuwing hapon. Pero hindi na po ako nagkakape. Kasi baka magka-form ako ng bad habit na uminom ng kape. Tapos, isa pa yung sa gadgets, nakababad ako sa laptop, pati sa cellphone ko, nag-Twitter, TikTok, or Messenger. Tapos yung naglalaro ako ng Sims 4. Ilang oras akong nasa tapat ng laptop. Kaya, sobrang dami ng screen time. Kaya, medyo ngayon, minsan na-feel ko na sumasakit na ulo ko or nahihilo ko. Kaya minsan, iniisip ko, kailangan ko rin na take ng rest. Tapos isa, hindi tayo nakakalabas masyado. We were more sedentary. Kaya, nandito lang tayo sa loob ng bahay. Pag kinumbine to, yung social interactions, yung nag-decrease yung social interactions, tapos disrupted sleeping patterns, academic performance, tapos pressure. Meron din na fear and worry na baka magkasakit ka and yung family mo. Pag nag-add up yun, pag nag-combine, it would really took a toll on our mental health po. Then last year, there was a call for academic freeze. Ang daming nangyayari outside, pero we're still expected to perform as if everything's normal. DepEd wanted to promote and push through with online classes. Naintindihan ko na yung ibang students walang means and financial capabilities for online classes kasi nagre-require sila ng laptop and ng stable internet. And naintindihan ko hindi lahat kayang ma-afford yun. Kaya this scenario made online learning seem like a privilege when all students have rights to quality education that they could not get and is worsened by the pandemic. As for my personal experience, my kuya was kind enough to lend me his laptop for our online class. Pero it was hard to share the internet with my 6 siblings po, 5 working and 1 college student po. And my parents, they're working from home. Mabagal po yung internet namin noon. Tapos po, aside sa studies ko, may responsibilities po ako dito sa bahay. Kaya kailangan gawin ko po yung mga assignment ko, quizzes and performance tasks ng maaga para hindi ako matatambakan ng gawain. Tapos, sa gabi, tutulungan ko si mama na mag-mop ng bahay, taas baba. Tapos, minsan, ako magluluto ng lunch or dinner. Maghuhugas ng pinagkainan. Isasalansan yung mga tinuping mga damit. Sinasabi ko lagi sa sarili ko na I should help my mom in any way possible kasi siya rin, pagod din siya sa work niya. So, ayun yung responsibilities ko sa night. Tapos sa umaga, mag-online class kami.
So parang ang daming responsibilities na meron ka. Yun nga, may parang you are a student but also you are a part of the family. Tapos yun nga, since lahat ng tao nasa bahay lang din no?
Yes po, pero the work is divided for us siblings po. So may fair share din po ng chores.
Okay. So hindi naman pala ikaw lang. Oo. Okay. Sige.
Tapos po, yung downside ng marami sa bahay, wala akong mahirap humanap ng spot kung saan walang distractions, like nag-uusap yung mga siblings ko when I'm in a class meeting or me talking to my siblings while my ate's teaching. No barking dogs because we have 8 dogs po.
Ay, wow. Oo. So, yun ba yung mga narinig namin kanina sa background? Parang may mga narinig akong tahol kanina eh.
Hindi ko po sure. Pero ngayon po tahimik naman po sila.
Okay. Sige.
Apo. Minsan, hindi po ako nakapag-concentrate sa sinasabi ng teacher ko po kung ano po yung tinuturo niya. Pero nung a few months, dun po ako tumatambay sa teles kasi po ako lang po nandun, tapos wala pong nakakapag-distract sa akin. Pero nandun po yung tatlo naming aso. So, medyo maingay po. Pero okay lang naman po kasi hindi naman po ako nagsasalita. Pero kapag kailangan po maghahanap po ako ng spot. Kunyari, maghihiramin ko po yung kwarto ng ate ko po. Doon po ako magpe-present kasama po ng mga classmates ko. Yun po. Tapos, last year, August po yata nun, nare-recall ko experience ko with my college applications. Kasi nag-near na yung mag-e-end na yung school year. So, kailangan ko na humanap. Kasi kailangan ko po mag-apply sa university. So, at first, yung university, nag-announce sila na hindi po sila mag-hold ng entrance exam. So, I was thrilled po kasi hindi na po mag-e-exam. So, less problems ko na po yun na hindi na po magre-review. Pero po, during the application period po, busy po ako sa mga schoolworks ko. Wala po akong time para asikasuhin po yung mga applications. Tapos po, in the end, I was rushing to get all the documents passed. Earlier this year, once the universities, I planned on applying to reopen their admissions. But sadly, I didn't get to pass one document because I ran out of time. So, for 1 month po sila nag-reopen from May 15 to June 15. Kaso po, yung isa pong document, fina-follow up ko po kaso hindi pa nagre-reply.
Oo. So, I think problem talaga yan, no? Yung pag-follow up with mga applications sa school. Oo.
Opo.
So, sige.
Pero po, on a brighter side, may silver linings din naman po sa online classes. Yung ibang students, nag-excel sila in their studies this year. And got to be a part of the honors list. Actually, for me po, hindi ko pa po alam kung ano pong, kasi po, sa July 30 pa po yung graduation. Kala ko po June 30 kasi na-misread ko po yung announcement. Pero po, next week, may rehearsal na po kami. Tapos, yung mga friends ko, part din sila ng honors list. Tapos, some online friends were part of the dean's list too. Happy ako that many of us can come out of this pandemic as a better versions of ourselves. On a personal note, since all my siblings are here at home with me, we spend a lot of time together. Kasi po, sampu po kami dito sa bahay. Tapos po, every spot, nandun po yung mga kapatid ko. Kung wala po sa kwarto, nandun po sa mga desk nila, dun sa sala. Kaya po, kung saan po pumunta, nandun po sila. Kahit po, nung una, nagbibiker po kami ng ate ko.
Anong pinag-aawayan niyo ng ate mo, if I may ask?
Yung naalala ko lang po kasi magwawalis po kasi sana ako ng bahay. Tapos po, nanghiram po ako ng earphone sa kuya ko kasi gusto ko po makinig sa music habang nag-sweep. Tapos, sinabi ng ate ko, kailangan ba talaga ng music para ma-motivate ka mag-sweep? Tapos, nakalimutan ko na po ng reply ko, pero ang sabi ko, gusto ko makinig kasi nakaka-motivate naman talaga. Tapos po yun, nakalimutan ko na pong iba, pero marami po talagang bickerings nung una. Pero ngayon okay naman po, masaya na kami. Pero I can always talk about my day with them, sa siblings ko, sa parents, or sa friends ko. Sometimes, I obsess over my K-pop group and interact with my online friends on Twitter. Tapos, isa ko rin ginagawa during this pandemic. Pero sometimes lang, I would memorize K-pop dances that I would later record and post on my Facebook account. Tapos earlier this morning po, I recorded 2 short dance covers like under 30 seconds lang naman po yun. After School by Weekly and Hello Future by NCT Dream. Yun po yung nagpapass ng time sa akin na mag-memorize tapos magre-record. Pero masaya rin naman po yun kahit minsan nakakapagod kung mag-memorize. Kasi po ang hirap ng choreography.
Oo, yun nga eh. Intense, di ba, yung choreography ng mga idols natin. Oo.
Opo. Tapos po, I'm also happy to share that I'm also an incoming freshman at my dream school with my dream course po.
Wow, congratulations!
Thank you po. This wraps up my experience with online learning and that I want to share with everyone here. Kagaya po ng title of our learning session today, I want to end my sharing with these 2 words, languishing and resilience po. To languish is to be forced to remain in an unpleasant situation. For the past year and a half, we were forced to stay in this situation that's not ideal for us, our education, and our mental health. But with the help of seminars like this, we will grow resilient in facing challenges. We will be able to withstand or recover quickly from the challenges the pandemic has brought. Sa fellow students and peers ko, do not hesitate to ask for help. Reach out to your family, friends, or professional po if needed. We need all the help we can get, and we will be able to overcome this pandemic together. There is still hope. I hope things na mag-return to normal soon. Pero while we're still here, let's all be resilient together. Thank you and good evening, everyone.
Okay, so thank you. Thank you, Mika, no, for sharing your experiences, especially during these times. No, so parang itong naging perspective mo was yung real life situation, no, na dinidiscuss ni Dr. Belle kanina. So at least yun,
Yes.
meron tayong fresh perspective, no, personal experience ng kung ano yung life, no, life of a teenager in a pandemic. So yan,
Yes,
thank
po.
you. No,
Thank you.
so okay, I will read a comment first, no. So this is from Dr. Aguadera. So dear Maria Mikaela, so you've gone a long way from an introvert youth to a confident person talking in this webinar. So thank you for sharing your experiences. Stay well from MDH Hub. So yan.
Thank you po.
Ayan, so, and also from Dr. Rodriguez. So, thank you, Mika, for your fresh, honest insights. And please stay hopeful. So,
Thank
yan.
you po.
So, ayan, dyan sa mga comments natin from Zoom and on Facebook. So, okay, no? And again, from our Vice President, Dr. Kainhug. So, ang galing mo naman, Mika. Yan, sabi ni Dr. Thank you for giving a voice to the Filipino teen. So,
No worries po.
ayan.
Thank you po.
Oo, so ang daming naka-appreciate ng talk mo, no? Kasi usually yon we just have perspectives from the professionals, but yun nga, yung experience mo was very enlightening. Oo. So sige, let me ask our speakers also, no? Si Dr. Belle and si Dr. RJ. So can you comment on what Mika shared with us? No, so anyone can go first, Dr. Belle or Dr. RJ?
Hello.
Yan, okay. Si Dr. Belle muna.
Thank you, Mika, for your sharing. It was really educational for me. I learned so much from you in terms of what it was really like. Because I do hear stories from other people, but the way that you explained it really made me feel it was a first-hand experience. And thank you for opening your life to us. And I see that there were really a lot of challenges that you had to deal with, from student
Yes
life,
po.
home life, diba? Personal life. But I agree with what Dr. Rodriguez said, that I felt the hope too, that you knew what you wanted to do. Despite the initial struggle, you tried to rise up to the challenge. And now you've found ways to be creative in using your time. You found a way to sleep better. And congratulations on getting into your dream university and your dream course.
Thank you po. Thank you po, Dr. Bell.
Thanks
Dr.
also.
RJ naman.
Yeah. Well, una sa lahat, salamat sa pagpapaunlak dito sa sa forum natin. Actually, nung in-invite po natin siya, sobrang nag-yes ka agad siya. And yun nga, parang first time yata ni ito na ma-invite sa isang professional na discussion. And I think dito nakita natin yung importance of hearing directly from the people who have lived through the experience, no? And hearing from dun sa experience ni sobrang ang daming na-touch on na mga concerns, and I think that that is something that is shared with a lot of young people under the pandemic right now. And sobrang nakuha ko yung sense na meron talaga tayong challenge ngayon in terms of forming that sense of community, no? Kasi for example, pag online class tayo, very transactional, no? Sabi ni kanina na after nila magkaroon ng isang group work nung event nila, hindi na rin niya naalala afterwards kung sino yung mga nakasama niya doon. So definitely yung mga ganon, yung mga tinatawag nating weak ties, no, with the online classes and the online setup can also impact yung natin, yung mga pagkakaroon ng social skills. And I think moving forward after the pandemic, this has to be a point of conversation. Kasi ngayon, baka yung mga kabataan, nahihirapan rin sila in terms of how they would relate to other people after the pandemic, and kung paano sila magkakaroon ng conflict resolution strategies later on. So yan po yung sa tingin ko na as early as now, we have to also think about paano ba natin matuturuan sila ng social skills outside of the online setup. And then of course, with the different stimuli that we get from the work from home setup tsaka yung online classes, nandiyan yung mga family members natin, nandiyan yung mga different notifications na nagpo-pop up sa phones natin. Tapos narinig ko na yung mga aso ni MM. So yung mga ganun, ang daming mga distractions. And definitely, it's something that we also should be concerned about. Kasi one of the readings na nabasa ko about languishing is that sabi niya doon na isa sa mga solutions on languishing is engagement, no? So si Martin Seligman talks a lot about engagement. It's actually being immersed dun sa ginagawa mo. And of course, if we're very distracted, baka maging siya, no? Maka-affect siya dun sa quality ng ginagawa natin, or even the fulfillment that we get after accomplishing a certain task. And when I was also nabasa ko rin yung Languishing, and napasmile talaga ako when I read it, kasi finally parang meron nang nag-encapsulate nung general feeling na meron tayo. Pero when I also reflected further, parang iniisip ko na parang it captures the general feeling na meron tayo, but at the same time I think it requires a lot of processing pa rin. Kasi I think yung feeling of languishing is very complex also. Baka may mga other feelings pa tayo na kailangan pag-usapan doon. And yun nga, parang siguro yung inisip ko rin right now is that when we talk about mental health, we usually think about how to address it at the individual level. No? Paano ba tayo mag-cope as individuals? And siguro dito na lumalabas yung bias ko as a community development student na paano ba natin i-address yung mga concerns natin collectively nasa community. Kasi yung mga experiences natin, these are something that are shared eh. Diba? So, and of course, we recognize naman na iba-iba yung meaning per person, pero sometime in the future, I think we have to have that sense of what this pandemic actually meant for us as a community, so that we can truly heal and move forward. So yun po, parang this is also a call na baka kailangan natin tignan how we can also mobilize our communities para i-address yung ating individual mental health concerns.
Yes, oo. And also we have a question here na kind of related, no, Doc RJ. Dr. Batar asked, what do you think could or should the government or educational institutions have done to assist our youth and promote their mental wellness? So, yon, and anyone can answer the question. So, okay, I'll repeat. Ano yung dapat gawin daw ng government, no? Tingin ninyo, or educational institutions, since yun nga, the online classes is, no, is an issue, no, that our teens are facing. And yun, parang what can be done to support our youth and promote yung mental wellness?
Siguro, Doc, I can start. Siguro una is that we have to have a comprehensive review of how education is being delivered right now in a time of pandemic. Kasi ako rin, personally, as someone who attends class online, syempre parang minsan yung mga things that our teachers, our professors were teaching us prior to the pandemic, baka hindi sila effectively ma-translate dun sa online environment. So, kumbaga, we have to rethink kung paano ba natin siniset yung mga deadlines, gano'ng karami ba yung information na pwedeng ibigay healthily to the students, and ano yung mga adjustments that we can do for the students who are directly suffering from mental health conditions, ano yung mga reasonable accommodations that we can do. And then, siguro second is that we have to really scale up yung mga services natin and adapt it to the online setup. Kasi even before naman, may mga challenges tayo when it comes to mental health systems natin, public mental health systems natin in school settings, di ba? So ngayon, parang baka additional challenge yan. How do we actually teach our guidance counselors to translate yung services nila online? So yung mga ganun po, baka kailangan natin pagigihan pa.
Mm-hmm. Okay, do you have anything else to add, Dr. Belle?
Personally, as a faculty member, I've witnessed how a lot of I'm talking about the level of med school. I've witnessed how we really try to help out the students in terms of finding ways so that the learning doesn't have to be additionally stressful for them. We know kasi right now that the schooling is already stressful in itself. So the way that we deliver the materials, and you're right, RJ, the amount of workload that we put, that we have them do, we try to really be careful so that you don't get burdened. Because we know that it's not 1 hour of in-person similar to 1 hour of online learning. It takes more effort to focus online, and it takes more effort to do things asynchronously. So I think I'm hoping that a lot of the schools are also aware of that need to accommodate and bring about changes in approach, like RG was saying. I think one of the ways that I also try to advocate for the students or for the youth in my role as a faculty is what RG was saying about deadlines. It's been implemented in one of the medical schools that I'm part of. Na deadlines shouldn't be at 12 midnight. I've tried to really raise it, na parang let's not make the life of the students difficult by making their sleep pattern so disturbed. So in one of the med schools that I teach, we've put a limit to deadlines at 5 p.m. So that after 5 p.m., the students can enjoy dinner, be with the family, go about their bedtime routine at the right time because it's important for their health. So at that small level, I think it can be a big difference, and we're hoping that it's in school. There's a lot of changes in terms of how we deliver learning, and it's ever changing even until now. And we're hoping that there can be a system so that we can hear from the students more about what you need. Diba? I think a lot of communication, didactics in terms of what you need is helpful. The academic phase, I think, is one way that the students were able to communicate their need that time, sinasabi ni Mika. So maybe a lot of dialogue is really important so that the schools and the universities and even the government will be aware of what the youth needs. Because more than anyone, you're the ones who know what you need.
Yes, so yun, I think I agree, no, yung dialogue talaga is very, very important. It's a two-way thing, no? And yun, sige, I'll just read some more comments, no? So, ayan, someone from Facebook mentioned that what a great friend, student, sister, and daughter you must be, Mika. Yun, so, and ayan, yun nga, relatable daw yung discussion mo, and it's very enlightening from a perspective of one of our listeners who's a teacher. So I guess yun nga, no, with the comments also of Dr. RJ and Dr. Belle. So yun, maintindihan rin nga yung perspective from a student naman, no? So ako meron akong personal question kay Mika, no? So dun sa i-relate lang natin dun sa nabanggit ni Dr. Belle kanina about building resilience. So alin dun kaya yung parang naging pinaka-helpful for you?
Actually po, most of them naman po, I talk to my parents po when I need help in my ACADS po, and to my siblings about my day. I chat with my friends through Messenger or Discord po. Here at home, iba po pala. Yung sa finding purpose po, kasi po, here at home po, every time na mag-grocery, ako po yung tiga-disinfect kasama po yung mom ko po. So, I could say na purpose ko po here is to keep things clean. So, my siblings would say po minsan, malinis ba to? And they would reply, malinis na yan, dinisinfect na ni MM yan. But as for finding my purpose in life po, I'm still working on finding that out po. Pero during the school year po, my friend would ask me to help her with her English grammar po. I felt that helping her with her English would help her learn and be fluent in English po. She graduated with honors and given certificates for her academic excellence in her subjects. Tapos po, foster wellness. As for a few months ago po, I started exercising po, working out. Because at the time, I was insecure of my weight po. Kala ko po, tumataba po ako noon kasi puro kain po ako noon. Pag bored ako, kain ako. Tapos midnight snacks, merienda. Pero this time po, a few months ago, after nung workout, I stopped po. But I think yung dancing po has the same effect as exercising din naman po in maintaining my weight. So sa dance na lang po ako nag-stick. And then embrace healthy thoughts and seek help. Sometimes po I would feel down without any reason po. Like wala pong thoughts, just like I'm sad but I have no thoughts. And doon po ako nag-write down ng feelings ko sa journal or pag-iisipan ko po kung ano po talagang nararamdaman ko po ngayon. Or minsan po, para maklear lang po yung thoughts ko, pupunta po ako sa Twitter or tinitingnan ko po yung mga K-pop albums ko po sa kwarto ko. Pero po, I know naman po na masasabi ko po lahat ng problems ko po sa family. Yun po, pag magsisik po ng help.
Okay, so yun, parang almost everything very useful for you.
Yes,
okay. So yun, let me ask naman si Dr. Belle and si Doc RJ, no. Kayo ba meron kayong naging experience on dealing with someone who is languishing during the pandemic? And when did you notice na mas common siya? During the early phase of the quarantine or yung ngayon?
Go ahead.
Sige, Doc RJ, you may go first.
Okay. Well, napansin po namin siya kasi ang daming nagme-message talaga sa Facebook page namin sa Youth for Mental Health Coalition. So, I think it comes with a decrease in access sa mga services. So, syempre, since nasa social media yung mga kabataan, doon sila nag-reach out. And napaka-iba-iba ng concerns. Sometimes it's related to online classes. Sometimes it's related to personal relationships. And even yung ilan yung mga nag-aalaga talaga sa mga family members nila. So it's a wide range of concerns coming from the youth. And I think yun nga, manifestation ito ng napaka-inaccessible na services natin. So sometimes we've encountered a person na yun nga, parang nahihiya raw siya dun sa parents niya mag-seek ng services kasi baka makabawas pa yan doon sa income nila as a family. So, isa sa mga challenge po natin yan ngayon. And sometimes, yung challenge natin is geographic, no, na inaccessibility of services. So with the restrictions happening right now, baka hindi rin ganun ka dali for them to go to yung mga face-to-face consultations nila before. And yun nga, parang when we talk about emergency services, no, hindi ganun kadali kasi sometimes they message our page tapos anonymous yung account. So yung mga ganun, it's a very unsettling feeling, lalo na pag nag-reach out sila sa'yo but you don't know how to help them kasi hindi mo malocate kung nasaan sila and everything. So, and of course, parang naging apparent talaga siya sa akin nung tumaas yung COVID cases because we started engaging with a telemedicine platform. Tapos nakita namin doon na ang daming mukhang young people na nag-avail ng services na related to mental health. So doon ko napansin na parang they're not necessarily nandoon sa diagnosable mental health conditions, hindi sila pumapasok sa DSM, pero meron silang mga challenges and I think important pa rin na na-emphasize yung specialized supports, especially now, kasi nasa bahay sila. And we all know na hindi ganun kalakas rin yung supports coming from our family members. The home is not always a safe space for young people. So later on, i-share ko yung mga interventions namin for that. But especially for the LGBT community, di ba? Hindi ganun kadali for them to express, no? And sometimes for people naman na kahit nasa heterosexual sila, hindi ganun kadali pa rin for them to open up to their family members. So it's something na napapansin natin and siguro hindi pa natin masabi na languishing sila kasi wala rin naman tayong criteria for it. Pero sa tingin ko, yun yung general sense that we're seeing right now.
Okay, sige. Dr. Rebel?
The question of do we see it, did we see it in the early part of this pandemic or later part? I think in the early part, what we saw more were distress reactions. We were really scrambling to cope with the changes. There was anguish. I think that was the right term. Anguish for all of those disruptions that were very sudden. The languishing seems to have come later on. Even when we found ways to deal with the situation to get by, it feels that getting by was just really getting by, not really thriving, not really being at your best. And yes, I do see it in practice. And the discussion of that experience, I think, is already a good first step in terms of being able to help, to acknowledge that it's there, that there is such a thing as not being okay even if you're not ill, that you're not completely well, don't have the best mental health, but it can be, and it can be better for you. So it's always about being able to identify those emotions, finding out the strengths, interests of the patients that I talk to, and really trying to find ways so that we can have those small senses of control, small wins daily, because we're dealing with something huge, and we don't necessarily have to deal with it in the same magnitude. We just have to take those small steps that will already make a big difference in how we feel on a daily basis. Sabi nga, di ba, ni Mika, yung cleaning, disinfecting, is already her having a purpose. And I'm sure it gives her a sense of an empowerment then, di ba? So I think it's celebrating the small wins and being able to still know what you want to do and take the small step towards them.
Yes, okay. So thank you for your answers, no? And yun, we have a comment lang from Zoom also addressed to Dr. RJ. So yun, it would help if the Y4MH could come up with a survey that could help policymakers at DepEd and DOH and the Philippine Council for Mental Health. So I think this is a good transition, no, for on your part of the talk kasi syempre interested din kami, no, ano ba yung mga programs ng Youth for Mental Health Coalition na specifically, no, for the mental health of our youth. So Dr. RJ, can you talk more about it?
Yeah, pero siguro pa i-consider namin yan kasi I think one of the challenges in terms of policy making as well as program development, especially for mental health, is wala tayong masyadong data. So siguro makakatulong talaga yan in terms of refining our programs as well as the programs of the government. But I'd like to share some slides lang po with regard to what we've been doing since the pandemic started. And just to give you a background about the Youth for Mental Health Coalition, we're an advocacy organization that started when I was still a medical clerk. No? So way back 2016. No? So and then later on, ngayon po we're a non-stock non-profit organization that advocates for mental health. So we're a youth-led, a youth-run organization. And yung first na ginawa po namin during that time is that we highlighted the importance of having a mental health policy in the Philippines. So yun nga po. So much of our work during that time was advocacy work. And then yun nga, we campaigned for the Philippine Mental Health Law until it actually passed last 2018. So yan, kasama po namin sila Doc Batar, sila Doc Banaag before. So nakakatuwa na ngayon yung pinaghirapan ng mga mental health professionals before, ngayon na nakikita na natin siya. No? And of course, we still continue engaging with various groups, no, for policy advocacy and program development. So right now, we're working with the DOH and the World Health Organization for crafting guidelines for responsible portrayal of mental health in media. Kasi isa po sa mga na-realize namin is that mental health promotion, especially yung destigmatization as well as awareness raising initiatives, are very important in terms of changing behavior. So that's one of the things that we're actively working on. And the second is that we're also working for yung review ng policy natin on substance use prevention as well as suicide prevention in schools. So right now, yun nga, parang we're also trying to localize yung mga initiatives natin in the school and workplace setting. And right now, kakatapos lang nung LGU playbook for mental health. So this is a partnership with the Department of Health so that we can have peer support groups for young people that hopefully will be funded by the local government units. No? So yan po yung isang sineset up natin. And that's available online as well as offline. And of course, active pa rin po tayo in terms of integrating mental health in local youth development plans. So we're working with Sangguniang Kabataan para just kahit na hindi nagko-continue yung online yung classes ngayon na face-to-face, meron pa rin sasalo sa kanila doon sa local level sa mga barangay. And then when the pandemic started, one of the initiatives that we've done is the Kapit Bisig para sa Siglang Isip. No? So it's a set of projects that we've conducted. So una ay yung buklod. So we shared information about how to cope, ano yung mga sources ng support that they can get both from yung mga patient support side as well as yung mga psychologists and psychiatrists natin. No? So pangalawa is that we also raised funds for to support yung mental health needs ng mga young people. No? So we conducted several fundraisers as well as donation drives. And then yung na-raise po namin na pondo dito is that some of it was allocated to buy medications. No? And some of it was used to subsidize for psychiatric and psychological consultation. So we've been partnering with several professional organizations and private organizations para kahit pa paano ma-subsidize kasi yun nga yung isang in-address po namin yung cost talaga of mental health services. And then we've also been conducting online support groups. So sabi ko nga po kanina, in lieu of face-to-face na support groups kasi prior to the pandemic, we've been conducting face-to-face support groups. So dito po sa may UST area, meron kaming isang place, so we call it the Youth Hub. And it's a place na dati parang we use it to gather people. Tapos kung may mga challenges sila, ina-allow namin sila magstay doon sa place na yan for quite some time. Lalo na kung nakadorm sila at malayo sa family. Pero right now nga, dahil hindi functional yung mga hubs natin because of the COVID-19 restrictions, we had to translate it to online. So yun, we've been conducting online support groups for young people. We've been conducting for LGBT specific, no? Kasi isa po sila sa mga target populations na actively partner din po namin. So ngayon, we're conducting Balur Kandungan. So it's a specific project for our LGBTQI friends to equip them with skills to cope as well as have an open space for discussion. So nagkakaroon din po kami ng Zoom dates. So it's an online discussion. So usual webinars na kwentuhan. And then every Sunday, we release a self-care Sunday. So ito yung mga tips on how to cope, related to sleep, related to exercise. So merong mga ganun po kaming release sa Facebook page ng Youth for Mental Health Coalition. And then right now, we're also conducting trainings for Sangguniang Kabataan officials and youth organizations on how to localize mental health programs and policies. No? So special attention na lang kasi online setting na yung inisip rin po naming method of delivery. And then we've also been partnering with sorry, we've been also been partnering with an online legal assistance clinic, no? So isa po sa mga partners namin ay yung Centro Escolar University. And if meron silang mga legal concerns, cases of discrimination, hindi sila ina-accept sa school dahil meron silang mental health concern or hindi sila makakuha ng trabaho, we refer them to legal support also. And then recently, we've launched a podcast. So it's called Less Serious, More Fun. So sobrang chill lang na ito na usapan with young people. So the first episode is that we invited an influencer. So she's a Miss World candidate who happens to be our member also sa Youth for Mental Health. So dito natin na pag-usapan yung iba't ibang mga concerns. So it's hosted by Kenny. So he's a clinical psychology student, and Yana, our current chairperson. So you can download it on Spotify. So pakinggan niyo po siya. And hopefully makatulong rin siya sa practice po natin. So those are just some of the activities, and a lot more I think needs to be done. So we're very open to partnerships with other organizations as well.
Yun, so thank you Dr. RJ. Ang daming ginagawa ng Youth for Mental Health. No, so nakakatuwa from personally, from a psychiatrist's perspective, na there are groups that can help us, help our patients, and not only yung patients lang but also the youth in general. Kasi yun nga, parang ayaw na rin natin, di ba, na maging patient sila actually. So kailangan inaano rin natin, minimake sure din natin na yun nga, they are taking care of their mental health, and we are making sure that yun nga, naaalagaan nila yung sarili nila mentally. So sige, I'll just read some comments lang from Zoom and Facebook. So this one is from Dr. Banaag. So thank you to the panelists for a great exchange, and I want to take this opportunity to personally thank Dr. RJ for organizing Y4MH. So a great ally for mental health. So yun, stay safe and well. All there is much to be done for mental health. So yun kasi yun nga nag-partner or nag-meet na kayo with si Dr. Banaag. Oo. And also there's a comment here that I hope that mental health can be made more accessible and affordable. So many people I know acknowledge they need professional help, but are deterred because of high cost of meds and consult, and hoping and wishing the government could help lessen the cost. So I think this is one of the programs of Y4MH, yung subsidies for medication and therapy consultation. But again, di ba, on a bigger scale. So syempre, maganda rin at the government level, we can do something about it. So, all right. So, so there are also interested participants for in joining, kasi actually yun din yung ano ko, parang main concern in my head. So like for example, I'm very interested to help, is there something ba that I can do to, like for example, volunteer for Youth for Mental Health, and for example naman for organizations, how can they partner and get in touch with you?
Yeah, actually yung ano po namin was already posted in the chat. Pero for those who are on Facebook, you can visit the Facebook page of the Youth for Mental Health Coalition. So we open for individual as well as organizational members. So yun po, usually sila po yung mga katrabaho namin sa advocacy work.
Okay, so they will just like message you, parang ganun ba?
Yes po, sa Facebook page namin. Or you can also reach out on Twitter at youth number 4 and then MH po.
Okay, yon. So for our listeners from on Zoom and on Facebook, so you can visit Youth for Mental Health Facebook page, and also on their Twitter account. And also yon, kanina na-mention ni Doc RJ yung kanilang podcast. So you can also listen there. And okay. Sige, let's read more. Okay. There's also a comment here. Thank you, Doc Naguit. I got invited by Miss Cora of Balay. So your program would be of great help on the ground for community health from CSWCD.
College ko yan.
Ay, ayan. Sa social work, no? So that, si Doc T daw, yung nag-comment kanina. Sir Tex. Okay. And, okay. Um, okay. So this is a parang a more particular question. Regarding membership or volunteering, I guess. So is the membership limited to a certain age bracket?
Yes po, kasi we actually function as a youth-led and youth-serving organization. So we of course follow yung ano po sa Youth and Nation Building Act na 15 to 30 years old for our members.
Okay. So kahit hindi na technically teenagers, pwede pa
Opo.
silang sumali.
Pero binuo namin yung alumni kasi yung ilan sa mga members namin nung nagsisimula pa lang kami ngayon, medyo lumampas na dun sa 30. So we're thinking of ways on how to still engage with them po.
Okay. So yon. So again, 15 to 30, right, Doc RJ? So yun po ang ating age bracket. So, okay. So there's also, can we invite somebody from the organization to be a resource speaker? Okay. So this is for, I think, for PSCAP, no? Yun. What about finding Doc RJ mga resource speakers? So can they also get in touch with you?
Yes po, sir. Actually, ano po, depende po siya doon sa specific topic in mind. So we try to match kung ano yung required na topics. So as much as possible, we want kasi na, yun nga, credible pa rin naman yung speaker kahit na bata sila. So we have a lot of clinical psychology graduates, mga psychometricians. So we also try to match it doon sa audience kasi minsan pag bata, mas prefer nila na mas bata rin yung pagkaka-discuss. No? So we as much as possible we want it to be age appropriate as well.
Yes, tsaka especially 'di ba kung yung talk sa teens din, so para medyo mas relatable siya. Oo. So ayan, so for our participants in Zoom, in the chat box you can see there the call for membership, no, for Youth for Mental Health. So and also there's a form there for partnerships, no. So it's according here, it's not only the partnerships are for research, for events, projects, programs, activities. So yun nga, as mentioned earlier, speaking engagement and promotions. So yan, there are links there. You can also text them and email. So yan. And okay, there are also hashtags, no, that they can use or they can look for to search yung mga advocacies and other programs ng Y4MH. So hashtag Y4MH, hashtag help is here, and hashtag move for mental health. So, ayan. Okay. I'm just looking at other questions or comments. So, sige. Okay. Okay. So ito, there is a question. Yes, ma'am.
Just a comment when it comes to one of the questions regarding free services, psychiatric services.
Yes, go ahead.
The National Center for Mental Health actually has a hotline where they offer free services. And as far as I know, they also are able to triage patients in terms of depending on the level of care that they need. So consultations are free at National Center for Mental Health for psychiatric patients.
Mm-hmm. Okay, so yan. You can also reach NCMH. No? So, okay. Are there any other questions or comments? Okay, so some of our questions are more of like consultation. So, we'll try to answer them in another platform or other occasion. So again, someone is thanking our speakers, no, for the lecture. Very eye-opening, no, ang naging discussions natin. And okay, sige, I'm just looking at others. So, mhm. All right. Sige. So, our apologies, no, because we are running out of time. So, I know that our discussion here is very engaging, no? There are a lot of questions na natanong, but unfortunately, yon, we only have a limited amount of time. And yon, maybe if there are other occasions, no, or other platforms, no, that we can have exchanges. So you can also ask your questions there, no? Okay, so since we are on the tail end of our session, so may we hear some final words, no, from our speakers. So what would be your message, no, to our listeners? So maybe we can start with Dr. Belle, and then Mika, and then lastly from Doc RJ.
Um, Hello. Okay. For
Yes, Dr.
me, we know that the pandemic is still happening, and it might still continue for a bit longer. So I think it's always what I tell my patients and everyone that I know: let's take care of ourselves, and let's be there for each other, so that we can still be all we can all grow from this experience eventually.
Okay, so thank you, Dr. Rabel. How about you, Mika? Any final words, no, to our listeners?
Mm, I just want to say thank you for the opportunity to let me share my experiences this pandemic. My experiences might not be all encompassing for all youth, but I think I have touched on topics that are shared by many students my age. I would also like to point out that I forgot to mention that earlier po na yung students are calling for hashtag ligtas na balik eskwela. Other countries were able to overcome the outbreak by prioritizing the needs of its healthcare system. So I hope the Philippine government prioritize its health situation to ensure a safe return to school for us students. I hope we continue to remove the stigma of mental health, especially among the youth, and encourage those who need it to seek the help they need. Thank you to the organizers and our participants today. I learned a lot from our sessions tonight. Please stay safe and God bless us all po.
Okay, so lastly, Doc RJ.
Siguro sa akin po parang with the pandemic happening right now, nagkaroon talaga ng spotlight in terms of our emotions, our feelings, and how it's actually impacting the different things that we do in our lives. No? And sa tingin ko po parang um, one thing that we've learned in the pandemic is to also learn how to experience our emotions. Kasi dati parang dun sa day-to-day na lives natin, parang we tend to invalidate pag negative na yung emotions. Parang ay, ituloy na lang natin. No? Pero ngayon parang nagkaroon tayo ng opportunity in terms of talking about these emotions. So hopefully sa sarili natin parang magkaroon tayo ng openness in terms of rethinking how we cope, and expand natin yung mga coping mechanisms natin, because the things that might have worked prior to the pandemic, baka hindi na sila effective right now. So, tingnan natin, ano ba yung other interventions, and siguro call rin ito for us to learn from each other in terms of what works and what doesn't. And yun nga, at the end of the day, it's always an individual experience in terms of healing and coping. Kaya nga, wag nating bigyan ng timeline yung sarili natin, kasi minsan, mas nakaka-pressure pa yun pag kunwari, sabi mo na parang few hours lang or days, okay ka na. So, i-ano natin, parang i-validate natin yung sarili nating mga feelings, kasi hindi tayo sanay na ganun yung ginagawa natin before.
So yes, ayan. So thank you to our speakers once again, no, for sharing their expertise and their experiences with us. No, so it was really a fruitful discussion, and I hope, no, that the session helped our participants in understanding what languishing is, and how to fight it by building resilience, no? And also, yun, increase your awareness on groups, no, that can help in taking care of the mental health of our youth. So yeah, Youth for Mental Health Coalition is here, no, to help us in doing that. Okay, so someone asked about certificates. So as a reminder po to everyone, for the certificates of attendance, so okay, it's already posted. Kind Click on the link, no, for the post session feedback, and after filling up the evaluation forms, you will be able to get your certificates. Okay, so okay, I'm not sure if that would be posted on Facebook as well, but in Zoom, there is the Google Forms document, no, that you can answer to give feedback, no, for us also. So okay. All right. So now, to formally close, no, our show, let me call the president of the Philippine Society for Child and Adolescent Psychiatry, Dr. Rodora Andrea Concepcion. Doctora.
Good evening to everyone, to all our speakers, and to all our audience and participants who joined us in tonight's webinar of the Philippine Society for Child and Adolescent Psychiatry. Tonight has been an informative and an active discussion on a topic devoted to the mental health and well being of the young members of the society, our adolescents, and how healthy coping and resilience can be achieved in these challenging and extraordinary times. The Philippine Society for Child and Adolescent Psychiatry, in collaboration with the Youth for Mental Health Coalition, would like to thank our excellent speakers for enlightening us on languishing, the mental health decline in teens during the pandemic, and building resilience. To our very own Dr. Belle Erika Nubla-Gestuvo of the Philippine Society for Child and Adolescent Psychiatry, to Dr. Raymond John Naguit of the Youth for Mental Health Coalition, which is also our partner society in this month's webinar, and to our teen speaker, Ms. Maria Mikaela Cabrera. Our acknowledgement to Dr. Larimer Hugo, our MC and moderator, for facilitating and engaging a good discussion between our speakers and our audience. Likewise, the Philippine Society for Child and Adolescent Psychiatry would like to sincerely thank Medicam for their kind support in these webinars on Peace Cup Conversations talk show series. Medicam will be our pharmaceutical partner in the next 3 months from July to September 2021 in these talk show series. We would like to sincerely acknowledge our friends in Medicam for their assistance in bringing this webinar to all of you tonight. They are Mr. Jonald Bautista, Mr. Norby Abeto, and Mr. Mel Dolor. To the Peace Cup Webinar Organizing Committee, our acknowledgement for their technical support to Doctors Daryl Calleja, Vanessa Kainhug, Jennifer Duway, Christine Avery, and Pauline Nang Lim. Dr. Vanessa Kainhug and Dr. Daryl Calleja are our coordinators for this month's webinar. We hope that you could all join us again next month and save the date on August 19 for another webinar of Peace Cup Conversations talk show series. It's going to be another interesting topic and discussion on locked down with ADHD, stories of family struggles and overcoming the challenges of ADHD in the time of the pandemic. Our partner society for this webinar will be the ADHD Society of the Philippines. Speaker will be Dr. Henrina Ranoy. Moderator will be Dr. Anne Princess Nespral. Again, this is Dr. Rodora Andrea Concepcion. Thank you for sharing with us your time and your kind attention. Good night and good health to everyone.
Okay, so thank you, Dr. Concepcion. For our speakers, certificates of appreciation will be given to you as well. Okay, so just a few more reminders before we really end our session. First, if you have questions no, for Y4MH, so you can access their FB page. And if you have questions, so if there are unanswered questions to PISCAP, you can email your questions at PISCAP, that's pscap.org at gmail.com. And also, the link for the post-session evaluation was also posted on the Facebook page, no, where we have our live session. Okay, so this ends no the first session of Peace Cup Conversations. So thank you to everyone who participated both in Zoom and on Facebook Live. Okay, so we hope to see you on the next session. So as Dr. Concepcion mentioned, that would be on August 19. And also in other activities of Peace Cup. No? So muli, maraming salamat at magandang gabi sa inyong lahat.